You're on.
All right, so first of all, I have total screen background envy because this is the only time my Mac has ever failed me. I cannot make a cool library or a cool circadian clock, but I'm gonna work on it. So I thought I would just add a little bit, it's interesting when you think about like how earthworms look and how development happens. The human beings are actually organized segmentally as well. And the way we're organized segmentally has to do with somites. So we know that they start about day 20 in the cervical region, and it's very timed. You add 3 per day. And the reason I have this great bicep down here is to remind you, if you're looking down on the embryo here, and here's our forming neural tube, so we're looking down on the neural tube, and you see these little bulges here that it says somite. Well, you're not actually looking at the somite. You're looking at ectoderm that's covering the somite. And so that's exactly the same as this beautiful skin that's covering that beautiful bicep. And I think sometimes that's a hard concept when you're looking at these images to understand. So again, they come in exactly 3 at a time, and you can tell the age of the embryo by where the somites are. So the paraxial mesoderm, so the mesoderm that's migrating near the axis of the developing embryo, creates this globs of tissue that are called somatomeres. And then they become those blocks of somites. And about the 4th week, the ventral and medial part loosen to become a sclerotome. So important here, again, going back, it's really helpful to learn the Latin and Greek roots of words because sclero means hard. So if I tell you it's a sclerotome, you're already going to know that this is probably going to become bone, which is one of the things that mesoderm becomes. But this basically shows you the migration of that sclerotome and that somite. So the somite is going to make up at each individual level of the human body the bone and the musculature. And so this, if you look at this again, if I can get it to play, you can see how it's going to migrate to in the thorax and abdomen to make those 3 layers of muscle. And then we'll learn later what happens when it condenses at the segmental level of the body that's going to become the arms and legs. So this is just another image of what Dr. Hill already explained in terms of the resegmentation and how the sclerotome, this portion, becomes actually the vertebrae, and again wrapped around, and this portion becomes, you can see the intervertebral disc and the body of the vertebrae. So this is the arch back here. This is the body of the vertebrae. So what happens then in development of the spine is you have these segments that are resegmenting and merging together. And the ossification centers that actually start this bone formation actually form in week 6. You don't get a complete fusion of the 2 halves of the vertebral arch back here until age 3 to 5. And the ossification of all of this continues up to 25 years of age. I know Dr. Hill's going to talk a lot about spina bifida. This is one of the clinical correlations that's an abnormal formation of the vertebral arch that has to do, again, with the somites and the sclerotome. And the other thing that is important to realize, if you have all these segments that are coming together, embryology is always a what could go wrong, right? So if you've got segments that are resegmenting and anterior and posterior and all oriented, it's pretty clear that that can get messed up, not uncommonly actually. And so you can get things where you have partial, fully segmented and with a unilateral complete failure of formation. So 1/2 of the segment doesn't form, it sort of forms. There's all kinds of variety of things that neurosurgeons and orthopedic surgeons have to understand about how spines don't form properly. And this is not actually from segmental defects, but it's a dramatic version of what happens as babies grow. And this is a congenital scoliosis. But I want to show you what we're talking about when we talk about scoliosis. and how bad it can get. So this is usually from neuromuscular disease, with this being secondary and not from the spine. But this is the kind of dramatic changes that you can get in scoliosis, both from segmentation defects and from this kind of congenital neuromuscular problems.